Yes, a very exciting time. Behind me, we have currently the outpatients building of the hospital, and directly behind me, within this area, there will be a mammography suite. The suite has actually now been completed. There's been a lot of work to make sure that it is completely safe for use. Thank you very much to the hospital team. And so the installation of the mammography equipment, which is on the island, will be completed within the next 2 months. So the building will be ready for service within the next 2 months. The service itself, the PS will be able to explain more about that to you. On this side here, we have a large platform where we are going to be installing a purpose-built container, which will be the accommodation for the new CT scanner. CT scanner, once again, is on the island. So as soon as this container arrives, we will be able to put the CT scanner into the container. And it'll be fully functional as if it was inside the hospital, and that will work well until the new hospital has been completed.
What is happening is that we are improving our diagnostic provision. We already have X-ray services and ultrasound services. So we're adding CT scanner and as well as mammography services. This is scheduled to be launched in Q2 of this year, which is not financial but calendar. Q2. And in addition to that, there'll also be the installation of a PAC system. This is where the images that are retrieved from the X-ray or the CT scanner or mammography are then displayed on an electronic system, so that the medical officers who are reviewing can have those electronic scans of whatever would have taken place when the service was offered.
So we are standing in the lab area. And here is going to be the general lab. So we'll have machines all along this wall. Here is our microbiology room. This is where we do cultures. And here is where the public will use. So here is where you will have your bloods drawn. And here is where you will donate blood, this room right here.
The new National Hospital project has several phases. And one of those phases, because we are on the path to being able to begin construction. So we would have embarked on refurbishing the Magotson Memorial Home, which is previously housed our elderly residents. This is being converted into lab, pharmacy, medical records on the top floor, and also support services like laundry, kitchen on the bottom floor. In terms of process, when this building is completed, which is towards the end of April, then we will begin the process of decanting. So we'll be removing all the services that are in the outer buildings on the hospital compound to here, to make way for the demolition of those buildings so that we can make ready the construction site for the new hospital. We would have launched the tender for the new National Hospital. We would have had 6 approved companies who would have indicated their interest. We would have done that process earlier on in 2023. So the tender would have gone directly to those 6 companies who would have just about 6 weeks to prepare, review, and submit their bids during April 2024. We anticipate that construction would begin towards the end. Well, in terms of mobilizing on site, we'll say May 2024. We are in the process of reviewing our overall elderly care provision. So that is being currently discussed. Reason being is that there are certain areas, in the new National Hospital that are not currently covered in terms of administrative space and so on. So we have to think broadly about the future and what we actually do. So that is being currently discussed in terms of the way forward.
Following on from what Pierre said, we are hoping to decant the services in May. So we are going to have some disruption because we have to transfer everything that is in the existing buildings to this facility. So we are asking the public to be patient with us, and it's for a good cause.
Well, certainly as project manager, it really feels like we've reached a milestone. It's very exciting. I know not just myself, but so many different partners, the health service, the project management, other government departments like Public Works, planning departments, so many have been involved. We are all really grateful to see that the work has been successful, and this is the fruit of our labours, and we're really excited to see things starting.
The Ministry of Health Glendon Hospital has been on a refurbished school site for more than 25 years. And the Ministry of Health and Social Services has a responsibility to the people of Montserrat, in fact, government of Montserrat. So for us to have reached this point where we are on the verge of constructing a new hospital with all the services under one roof, I can only say that we're very, very excited, and we actually look forward, as I always say, even just to be here for the contractor being on site. And I'm hoping that ZGB will join us on that day when the contractor mobilizes, because it will be a real positive step for the government of Montserrat. So I'm really looking forward to the opportunity where we have all our service provision under one roof, and we can totally improve the service that we offer to the people of Montserrat and for those people who visit us from time to time.
At the moment we're standing in the back half of the hospital. Behind us you'll see the existing administration building. Where this building is going to be the front entrance of the new hospital. And the new hospital will spread across the whole of the back of the site. They'll have a central area here and a wing down that side which is towards the airport, and another wing down this side which is towards Lookout. The wing on that side is going to house the ward upstairs and all of your day services downstairs. The wing on that side is going to house all of your support services, laundries, theatres, kitchens, all that sort of thing. And in the middle, this area that joins both of them is going to have downstairs a conference room, a cafe, and similar sorts of facilities, and upstairs is going to be administration. So at the time that we start the building, we will have a hoarding fence that goes up more or less where I'm standing, going from the airport side through to the Lookout side, and it will then separate out this area so that we can give it to the contractors. All of the buildings that you see will be demolished. So that's from the building that currently houses the pharmacy and the laboratory, the administration, and the physio building down that side, and everything behind it. Everything will be demolished. A building that will remain on this side is the existing wards building, and the ministry will determine how that building is going to be used, but it will be available for things, for example, any future pandemics. So a lot to be seen for the remainder of this year with all of this work commencing. To date, I would say that the biggest challenge that we've had has been the extensive procurement. I think you can understand with projects of this nature there is so much procurement, so much specialist procurement as well. And just the extreme amount of it has posed a challenge for us. The positive things we've learned from that, and many unexpected things like weather events such as hurricanes that we've had to change shipping and all sorts of things to accommodate that. And going forward, we will implement mitigating actions to make sure that we have less impact in future.
I would like to take this opportunity to say thanks to all of the many players that are involved in this reality of the dawn of a new Glendon Hospital. So we have all the players within Government of Montserrat, Ministry of Health and Social Services staff, our project manager, Mr. Hannes de Bruin, the Program Management Office, the Ministry of Finance, Public Works Department, the Physical Planning Unit within the Ministry of Agriculture, all of those government partners, Montserrat Utilities Limited, Cabinet, and of course, this would not have been possible without the funding of the Foreign and Commonwealth Development Office, who would have who is providing the financing for the new National Hospital, as well as all of the life safety critical equipment that will be launched, services that will be launched and in place long before even the new National Hospital is constructed. So we just want to say thank you from the Ministry of Health and on behalf of the Minister to all of the partners who are soldiering with us as we get to that time when we can occupy our new facilities. It's important to note that we, within the Ministry of Health, we have not just sat around to wait until the construction of a new national hospital. Over the last 5 to 6 years, we would have been continuously improving our services. So in one area, we would have expanded our visiting specialist services. So we now have specialist language and speech therapists who provide services for our children in the primary care sector. We would have reintroduced the services from the eye doctor who visits once a month or sometimes twice a month from Antigua, so we're able to provide those services. We have also introduced or reintroduced endoscopic services, which spans throughout the year. We also have introduced urology services. We have the visiting urologist this week. So just to say that even though you may not hear it on the airwaves, we have also expanded our local provision of medical services. I remember when I joined the Ministry of Health, we were having a little crisis in terms of provision of medical officers. We are now up to about 11. And we also have some specialist services on board within our staff. We would have just appointed an obstetrician gynecologist. So we are providing for the service for the people of Montserrat. And just to say that even though we don't have the new building yet, we have not stopped improving. We ensure that we provide these services to people on a regular basis.
So Ministry of Health is aware that we may require additional staff or skills training as we move towards the new hospital. And that is one of the activities that has been planned in terms of refining our needs. But what we continue to do as we expand our services presently is to review our human resource needs. So for example, as we're about to embark on the CT and mammography services, we have already sent one of our radiographers to Jamaica, and another one will leave shortly to undergo training. And so we have started that work as we expand. And so by the time we move to the new hospital, we expect that we will have all the services. What happens every year is that each ministry is required to submit a training list, needs list. And so the ministry decides, okay, anticipates the needs and decides, okay, this is what we need, and we submit so we can be supported through the HRMU. We create our business cases for submission with the budget. So even though that process has not been finalized, we are already in progress in terms of improving our human resource development.